Assalamu alaikum to my students and doctors and my friends. Today we are performing a ultrasound of a patient of a 35-year age. And this is uterus. I am performing with the probe, linear probe. You see, this is a mass in the interior side of the uterus, anterior side of the uterus. You are seeing this is a muscle, and below it is a uterus. There is a mass in the muscle, and the patient feels pain in during menstruation. This is a ultrasound of a female patient. You see, this is endometrium, and this is uterus. This is the endometrium, and this is a tract which is connecting with the anterior side of the mass, and this is the upper one is muscle. So this is the muscle, and you see this is mass in the muscle, but it is very irregular in shape and mixed pattern. There is a tract. You see, this is a tract. Your some endometrial tissue may be gone to this tract, to the site, and you can observe it. I am doing this with the probe of linear probe, and you can do with the convex probe as well. I will see the patient with the convex probe as well. So you can do with linear or convex, up to you. This is the mass, and painful and feeling some swelling in the interior wall and the incision site, and patient have 3 cesarean section before. Now we check the vascularity of this mass. Is it vascular or not? We put the Doppler. You check and see this is a flow is positive. So this mass is vascular in nature and irregular in shape. This is the flow. You can see it, and this is vascular flow of the mass. So what will be in your mind? What is this? This is some endometrial tissue into the interior side of the uterus and the muscle. This is the mass. So we do, and after that I will see the linear probe as well. You can check it, the linear probe, and this is the mass we are seeing. Now I will see you with the convex probe. So this is the uterus, endometrium, and cervix, unibladder. This is a unibladder wall. This is cervix and the retrovertebral uterus. Their tract is also seen by the linear convex probe. You see this mass is in the interior side, and tract is also there. Patient feel pain during menstruation, and the mass is vascularity you can see by convex probe as well. Many students and doctors have the convex probe, not the linear, so you can perform with convex probe as well. And you see this is a irregular mass, and we can check the vascularity. The vascular mass, this is below is uterus and above is the mass. The mass is vascular. The tract is seen. This is a vascular mass, and endometrial tissue outside the uterus can be called endometriosis or abdominal wall endometrioma. Thank you.